Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient's status post right transfemoral amputation is prescribed a standard wheelchair with recommendation for posterior rear wheel axle placement. What is the result of this positioning? Option 1, decreased wheelchair rear stability. Option 2, decreased wheelchair rolling resistance. Option 3, decreased turning radius. Option 4, decreased ease of performing wheelies. Manual wheelchairs are prescribed for patients that possess the strength and coordination to propel the wheelchair for household or community mobility. Therapists should be familiar with the various components of manual wheelchairs in order to prescribe the most effective and safe wheelchair. Posterior rear wheel axle placement is helpful for individuals with transfemoral amputations who may have challenges with balance or posture. The more rearward placement of the wheels shifts the center of gravity slightly, preventing tipping and making the chair more stable. Let's explore each of the options. Option 1, decreased wheelchair rear stability. The wheelchair stability will increase when moving the rear wheel axle posteriorly, since the center of gravity or seat is positioned more anteriorly within the wheelchair. An anteriorly placed rear axle would decrease overall wheelchair stability. Option 2, decrease wheelchair rolling resistance. Rolling resistance is the inherent resistance to rolling that is affected by weight distribution between the front and rear wheels. Rolling resistance is increased when moving the rear wheel axle posteriorly and decreased when moving the rear wheel axle anteriorly. Option 3, decreased turning radius. When moving the rear wheel axle posteriorly, the wheelchair increases in overall depth and therefore requires a greater or increased turning radius to negotiate turns. Option 4, decreased ease of performing wheelies. There is decreased ease of performing wheelies when the rear wheel axle is positioned posteriorly, since this modification increases the overall difficulty of tilting the wheelchair backwards. The correct answer is option 4. Let's explore the all-student data. 11% of students selected option 1, decreased wheelchair rear stability. 20% of students selected option 2, decreased wheelchair rolling resistance. 22% of students selected option 3, decreased turning radius. 47% of students selected option 4, decreased ease of performing wheelies. The correct response. System classification. This question is a non-systems question, which represents approximately 14% of all exam items. Content outline classification. This question is an equipment, devices, and technologies, therapeutic modalities question, which represents approximately 6% of all exam items. Level classification. This question is a level 2 question, since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out pages 692 through 694 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.